Welcome to the University of Missouri Otolaryngology Head and Neck Surgery Department. I'm David Chang. I'm the Program Director for the department. If you're an applicant, a medical student, or just wanting to know a little bit more about who we are, you've come to the right spot. Join me for the next few minutes as we delve into a little bit more about what we do, our faculty, and our department. Thank you.
I'd like to introduce to you our program based on three areas: patient care, medical knowledge, and discovery. Patient care begins talking to you about our facilities. Our flagship centers are made up of the University Hospital, Women's and Children's Center, and the Harry S. Truman VA. The University Hospital is our main flagship center. It is where our academic offices are housed. It's also where we have our Level 1 Trauma Center and most of our inpatient services, including the MICU, the SICU, and the Neurointensive Care Unit as well. The Ellis Fischel Cancer Center, where we see most of our head and neck cancer patients, is also located in this facility. The Women's and Children's Hospital is located on our Keene Street campus. Keene Street is on the other side of town, but literally that's about a 15-minute drive during the day. The Keene Street campus is where a vast majority of our pediatric care is performed. There are inpatient and outpatient operating rooms for pediatric children. There is an ambulatory surgery center, as well as 3 of our outpatient clinics, including the ENT Allergy Center, the Hearing and Balance Center, and Columbia ENT. The Harry S. Truman VA is literally a stone's throw away from the main hospital. It has 123 beds and 380,000 outpatient visits. It's where our residents get hands-on first-line care of patients that are really their own. There is a faculty member that provides oversight and supervision, but the patients at the VA are chiefly managed and cared for by our resident physicians. Next, I'd like to highlight our services that we have available at the University of Missouri Otolaryngology Head and Neck Surgery. First, our neurotology and otology service line is led by Dr. Arnie Rivera. We are the region's only cochlear implant center, and we perform acoustic neuromas and skull-based surgery in conjunction with our neurosurgery colleagues. Chronic ear disease is certainly a large component of our practice, and this is all facilitated out of our Hearing and Balance Center. Next, allergy and rhinology encompass a huge component of our practice. We perform the lion's share of immunotherapy for our University of Missouri system. We offer both sublingual immunotherapy as well as subcutaneous immunotherapy. We also do food and drug testing as well. As a complement, our surgeons offer endoscopic sinus surgery for chronic sinus disease, skull-based neoplasms, as well as for pituitary hypophysectomies in conjunction with our neurosurgery colleagues. Additionally, we work with our ophthalmologic colleagues to perform endoscopic orbital decompressions as well as endoscopic dacrocystorhinostomies. Pediatric otolaryngology is run by our faculty member, Dr. Eliav Gavari, who's pictured here in this upper right-hand corner. He works in conjunction with GI and pulmonary to provide multidisciplinary care for our pediatric patients. Dr. Gavari works hand in hand with our obstetrician and pediatric colleagues also to provide airway support for exit procedures. He also has extensive experience with neoplastics as well as infectious disease, pediatric otolaryngology issues. Our laryngology and bronchoesophagology expertise is led by Dr. Mark Gilbert, who received his fellowship training from Vanderbilt University. He has an interest in all things to do with swallowing as well as professional voice care, as well as airway issues, often seen after tracheostomy or airway burns. Facial plastic surgery is another component of our practice, whether it's cosmetic facial plastic issues, such as facelifts, blepharoplasties, and rhinoplasties, whether it's also trauma, in which we also share with our plastic surgery colleagues for trauma call. Free tissue transfer is in our wheelhouse of skill set as well, as we have 2 microvascular surgeons within our practice, Dr. Tabitha Galloway, as well as Dr. Pat Tizone. Head and neck oncology is a large component of our practice as well. We offer robotic surgery and multidisciplinary cancer care. Our otolaryngology department has a lion's share of the thyroid and parathyroid work that's done for the university. We probably do more than 90% of all the thyroid, parathyroid work, with maybe 10% done by our general surgery colleagues. Again, microvascular reconstruction is in our wheelhouse of skill set. We also offer endoscopy, as well as hypoglossal nerve stimulation for sleep apnea. And here's a picture of all of our faculty. You can find more about us through our website at ent.missouri.edu. There you can find the bios of all our faculty members, as well as a wealth of other information about our otolaryngology department and program. Let's dive in a little bit more to medical knowledge, which is what distinguishes our program from other programs. First, let's start with surgical experience. Our graduates graduate with at least 2,000 to 2,600 cases, and I just wanted to highlight some areas of caseload that they've experienced. Now, if you take a look at any case record of graduates, it's quite varied depending upon, how intensely each graduate logs each case and what type of cases they log. They could log anything from substantial cases to anything, fairly small like lacerations. This makes looking simply at the total case number a little bit unreliable. If you look at key indicator cases are felt to be those cases determined by the ACGME that determine the health and robustness of otolaryngology experience from training program to training program. For these key indicator cases, our graduates have graduated in over the 75th percentile in tympanoplasties, over the 60th percentile in thyroid and parathyroid cases, over the 50th percentile in other key indicator cases such as oral cavity resection, facial fractures, flaps, grafts, bronchoscopy, mastoidectomy, and ossicular chain reconstruction and stapedectomy. Our didactics are quite varied and wide in breadth. They consist of anything from grand rounds, which are both faculty and resident-led. I feel that grand rounds are an important part of learning, not only as the person that is listening to grand rounds, but also to those that are leading the grand rounds themselves. And so that's why I think it's also important that some of the grand rounds are resident-led. We assign resident-led grand rounds based upon their areas of weakness on the otolaryngology training examination, so it allows each resident to further delve into those areas that they need a little more boost in. In addition, we have external lecturers come to talk about radiology, pathology, oculoplastics, and neurosurgical kind of interactions that we have with them. We have business and medicine lectures, subspecialty conferences, as well as journal clubs. Learning is not just about reading a textbook or learning simply by observation or by practice in the operating room, but also by having a safe place in which you can try out your skills. These opportunities can be found in workshops that we either host ourselves or workshops that you'll have the opportunity to go to other institutions to enjoy. Some in-house workshops that we have include a microvascular lab, temporal bone drilling course, and an allergy workshop. We have partnered with our colleagues in St. Louis to do a PGY2 simulation boot camp, as well as a sinus surgery hands-on workshop. The opportunities to go to great courses and great workshops extend throughout the years of your training here at the University of Missouri, and are also supported by our Resident Rewards program, which we'll talk about here in just a second. The Harry S. Truman VA is a vital component to the learning process of our residents. A PGY2, PGY3, and a PGY5 resident typically are in charge with providing care to our veterans in a graduated fashion. Of course, they are staffed by a Mizzou ENT physician, but it offers a greater opportunity for autonomy and the ability to stretch your wings and learn and experience a little bit more on your own. Let's talk a little bit more about our outcomes from our training program. We are very proud that every year our otolaryngology residents do exceptionally well on the otolaryngology training examination. The graph on the right shows a curve of all otolaryngology training programs and how they fared on the otolaryngology training examination. The red line represents where Mizzou ENT, our residents, fall on that curve. Every year we are well right shifted above the median score. Where do our residents go after residency? Historically, a vast majority of our residents have gone into private practice right away. They've received adequate training and feel very comfortable with moving into practice right away. In the past 5 years, we have had about 50% of our residents enter into fellowship, as seen in this slide here, and then entering into a smattering of private practice as well as academic practice opportunities. Our department has been around for 50 years. It started off as a division of general surgery, but it has blossomed into its department of its own right and has done exceedingly well here at the University of Missouri. We hope you recognize some of these faces as you make your travels around the United States and meet otolaryngologists in the future. Our alumni are scattered throughout the United States in all of these gold-colored states as you see on this map. We have a few states that we need to populate and hope that if you're from one of these states, we will get you to match with us. Let's talk about research. The discovery component of residency education is a very important part of learning how to be an otolaryngologist, but also assessing the literature. We have 2 PhD faculty members on our staff. Pictured here is Dr. Lever. Also newly recruited to our department is Dr. Baker. Dr. Lever has interests in swallowing and dysphagia. Dr. Baker has interests in xerostomia and salivary gland. Research is integrated into the Otolaryngology Residency with a 3-month research block. There are 2 months that you will be able to do dedicated research as a PGY3 resident, and there will be 1 month dedicated as a PGY4. This allows for early development of a research project, allowing it to percolate and grow a little bit more, and then returning back to it in the PGY4 to harvest hopefully greater information as well as a more mature product at that time. I'd also like to highlight our residency reward system here. The residency reward system, think of it as like frequent flyer miles. Points are provided for accomplishments such as scholarly activity, whether it is a retrospective review, whether it's a major basic science project that is submitted or accepted for publication. Other point-worthy accomplishments include poster presentations or oral presentations to local or national meetings, doing well on the in-service trainings exam, receiving positive written feedback for patient care, whether from attendings or from patients themselves, as well as participation in local and national committees, as well as lectures to other ancillary medical students and residents in other departments, nursing, and clinic staff. We certainly would like to extend our appreciation to the residents for all these additional activities that make a good physician. Each activity is rewarded points. Each point equals $1 into your cash kitty that is allowed for spending on further educational items that will enhance your learning throughout your residency career. Points are capped at a lifetime number of about 12,500. As you can see here on this graph, over the years since we've had the rewards program, we've rewarded anywhere from $5,000 to $12,500 plus dollars per resident over the lifetime of their residency. What do residents choose to do with their points, and where do they spend these points? The vast majority of the points are spent on travel to meetings and courses, but also have been used for books, question banks and journals, equipment such as loops, and also other miscellaneous items such as dues and memberships to various organizations. Throughout your residency here, we hope to give you the tools that will allow you to achieve mastery, autonomy, and purpose in your professional life. Thanks for joining us today. If you want to learn more about us, please go to www.ent.missouri.edu.